Hello, my name is Samantha Morley, and today I'm discussing the case connections for Unit 4. So the first case that I worked on today is case 1. So in this case, a newborn girl appeared normal at birth, but within 24 hours she developed lethargy, hypothermia, and apnea. Her initial blood ammonia level was elevated at 314 micrograms per DL and rose to 600. The normal mechanisms of ammonia transfer in the body that should be occurring takes place in all cells of the body from metabolism of amino acids and nitrogen-containing compounds. This ammonia is produced in the body from transamination and deamination. The process of transamination is when an amino group becomes removed from an amino acids and is transferred to a keto acid and becomes catalyzed, and deamination is when amino groups are removed. Transamination is important to understand because it causes catabolism of amino acids and converts essential amino acids into non-essential amino acids. Amino acids are transaminated to form glutamate amino acids, and glutamate goes through oxidative deamination to form free ammonia for the glucose-alanine cycle. When urea is excreted from the body, it is important to know the role of glutamate dehydrogenase, which is an enzyme that catalyzes reversible conversion of glutamate to alpha-ketoglutarate and ammonia. Nitrogen transport is connected to gluconeogenesis in the fasted state because when carbohydrates are depleted, amino acids are then utilized for gluconeogenesis, and the glucose-alanine cycle transports ammonia from muscles to the liver. Then we see that further analysis shows urine uric acid levels were elevated, and the plasma citrulline level was normal. The enzyme that is most likely deficient is ornithine transcarbamylase, or OTC deficiency. Arginase, arginosuccinase, and arginosuccinate synthetase are least likely to occur. Lastly, if an amino acid were to become essential, it would be arginine because if there is a deficiency of the urea cycle, this would lead to production of amino acids. So second, I worked on case 2. And for this scenario, for scenario 1, a full-term girl was born by normal vaginal delivery and released from the hospital at age 3. She was screened for branched-chain amino acids, and there was no history of genetic disease in either family. The most likely enzyme deficiency in this case is a deficiency in branched-chain alpha-keto acid dehydrogenase because it is responsible for metabolizing amino acids such as valine, leucine, and isoleucine. If any amino acids become essential, it would be valine, leucine, and isoleucine. So then some potential supplements that may help include a lot of the B vitamins, so thiamine or vitamin B1, riboflavin or vitamin B2, niacin, pyridoxine, and L-carnitine. So next, for scenario 2, a 69-year-old woman was presented with a 30-year history of lower back and joint pain. Pigmented macules were present over the ears and the sclera, and past medical history included aortic stenosis. Based on these symptoms, it is most likely a homogentisate 1,2 dioxygenase deficiency. With this deficiency, homogentistic acid builds up and is not metabolized. If any amino acids become essential, it would be tyrosine and phenylalanine. Potential supplements that may help include vitamin C supplementation or vitamin E. And then lastly, for the third scenario, a 4-day-old infant is being followed with a birth weight of 5.9 pounds and a normal phenylalanine level. So the most likely enzyme deficiency here is phenylalanine hydroxylase. With this deficiency, phenylalanine accumulates in the blood, causing damage to the central nervous system. If any amino acids become essential, it would be tyrosine. And some important supplements or vitamins would be vitamin B6 may be beneficial to help PAH as a cofactor. And also vitamin C may also be helpful to reduce toxic metabolites. Thank you, and that is all for my case connections.